together today for a very important topic of compassionate recovery using IFS for addiction. Let's start with a brief meditation to ground ourselves and to foster a mindset of compassion and courage. So just find a comfortable position. You can be sitting, you can be lying down as you wish. And allow yourself a moment to settle into present moment. I invite you to put one hand on your chest, heart area, another one on your belly, and just take a couple of deep breaths, purposeful breaths. And as you inhale, imagine drawing in compassion and strength. And with every exhale, gently let go any doubts or anxieties that you might be holding. Inhale, bringing in compassion, strength, and exhale, letting go any doubts or anxieties. Now turn your awareness to your body. Notice any sensations, perhaps areas where you feel discomfort or tension, which may be signaled from underlying emotional challenges or stresses. With kindness and without judgment, acknowledge the sensation. These are messages from parts of yourself that may be you feeling overwhelmed or that need care. So just acknowledge them, don't judge them. Now continue to breathe. And with every exhale, imagine sending a wave of compassion to those areas where you feel any discomfort or tension. Visualize this compassion as a soothing, warm light, easing any tension and creating space for healing and understanding. This mindful breathing is a way to connect more deeply with ourselves, recognizing that the protective intentions behind even our most challenging emotions or behaviors as we move through the day's session, we will explore these emotions and behaviors with the aim of fostering understanding and self-compassion. This journey, let it be an opportunity to strengthen the courageous, caring presence within each of us, which is essential for our recovery and growth. Let's embrace this time together with open heart and mind, and ready to engage with the transformative power of IFS therapy. Thank you for your bravery and willingness to explore this path of compassionate recovery. So we will get into about 20 minutes of explaining. Welcome back. Okay, so our session will go about 20 minutes of explaining a little bit about understanding addiction from a perspective of IFS. And then we'll get into a little bit more deeper into how some of the addictive behaviors can be worked on, the aspect of compassion in the recovery, especially when we talk about addictive parts. And then we'll get into preparing for the session itself. Then we'll get into session, and I will work and I will explain as we go forward how we are going to work today. And if you have time, then we will do sound work. Otherwise, we'll just use tuning forks in the ending meditation. and then we will open up for Q&A at the end of the hour. Now, let's get into understanding addiction through the lens of IFS. Now, in our IFS model, we view addiction not as a disease in itself, but as part of us that has taken an extreme role. In other words, addiction is a manifestation of parts within ourselves engaging in extreme and often protective behaviors because they are trying to cope with vulnerability and emotional pain, which often comes from traumas of the past. Now, this part of the addictive part, what it's doing is it's trying to protect us typically from pain of the trauma. For example, if someone has a part that turns to alcohol, it's often because this part wants to numb the pain or to provide escape from stress. And in addiction, exiles play the key role, traumas. Okay, so addiction often arises when we have exiles. Exiles are what? These are vulnerable, hurt part of us that are too overwhelming. These are traumas that have happened in the past, and the whole system feels overwhelmed in dealing with it. So it creates these addictive, what I call firefighters. And the addictive behavior actually acts as a firefighter trying to extinguish the emotional intensity caused by the exiles, by the pain. So imagine someone who has experienced significant loss. The part that urges to gamble might be trying to distract from the deep sadness of the loss. I was recently working with someone who has substance addiction, and the firefighter actually made him do it because he was in extreme pain of losses. He lost his caretaker, his grandmother and grandfather, all within a period of 1 year when he was 6 years old. And that pain of the loss could not be handled by a system. And that's the part that made him go towards substance. We also have to understand what is called managers. Okay? So in IFS, managers try to keep us functional and safe day-to-day working. They are like the organizers. That's why they're called managers. Okay. However, when the pain from the exile becomes too intense, which means if that pain gets triggered, then firefighter jumps in as an impulsive behavior to protect from the pain. So if a manager of a person gets overwhelmed, for example, due to extreme stress at work, this may trigger the firefighter that may step in then to do either binging or alcohol or any substance or gambling as a way to minimize the pain. And the main goal in IFS is to foster what we call self-leadership. Now, this involves leading from a place of compassion, curiosity, and calmness. And we will see it in the session as well. And we will talk about this in the next slide. I'll explain why compassion is so important. So when we lead from self, we can actually negotiate with the addictive parts and understand their positive intent. For example, by acknowledging a part that smokes to reduce anxiety, we can often find healthier ways to manage that anxiety and hence avoid to trigger the firefighter. Now, so in summary, just to say that through the lens of IFS, we see addiction as a symptom of underlying parts in distress, not the core problem itself. And by understanding and healing these parts with compassion, promoting self-leadership, we can address root cause of the addictive behaviors, which then starts to create lasting recovery from addiction. Let's get into understanding the core principles of IFS therapy in the context of addiction. So in IFS, self is seen as the core of your being. Inherently, it contains all the qualities like compassion, curiosity, confidence, calmness, and, and connectedness. So, unlike parts which might become burdened with life experiences, the self is always unburdened and whole. For instance, when someone feels overwhelmed by addiction or by addictive activity or actions, IFS encourages tapping into self energy to lead the healing process. And you will see that happening in the session as well. And the parts are not what they seem to be. While we discussed how parts play a role in addiction, its role to it is actually crucial to understand that all parts have positive intentions. For example, a part that leads to substance or alcohol use may be because it's trying to protect you from emotional pain. And recognizing this intention helps shifting from fighting these parts or being against them or having strong emotions like shame and guilt around them to appreciating and working with them to find healthier strategies. And the goal of harmony and balance in IFS, what we try and do is to create a balance and harmony among all parts by restoring their roles to the ones that serve the individual positively. For example, transforming a part from a destructive firefighter to a more protective and less extreme manager helps integrate the part more healthy into one system. So this is why what we will, and we will also do it in the session, is we will try to come and be in contact with the firefighter, try to understand its intention and see where it comes from. And then we will go to the manager, which is the one that is going to have the guilt or shame around this and help it to integrate them together. The healing process in IFS involves the self taking a leadership role. This is why encouraging compassion, curiosity, etc., and healing the parts with having that compassion, that understanding, that curiosity. When self leads, parts feel safe to step back from the extreme roles. For instance, when a person leads with self-compassion, the part that uses anger or guilt or shame as a protection might feel secure enough to relax and allow for more adaptive coping mechanisms or moving forward. So in summary, what we in from an IFS perspective, we focus on always finding the positive intentions of the parts, whether they are firefighters or managers. And this then leads to some form of transformation where parts are not seen as enemies or something negative, but valuable aspects of person's psyche that needs more attention and care. So let's get into understanding a little bit more. Now, there's a big role that compassion plays in IFS. And it's one of the core quality of self. And the reason why we always go to compassion is because when you're in a place of compassion, you cannot have anger, frustration, etc. there. So it's neurologically impossible. So what it also does is that it gives the capacity to engage with the other parts that may be in a state of shame, guilt, or anger, etc. For example, when we are going to be working with addressing addiction, instead of judging ourselves for a relapse or drinking again or taking that binging one more time, what we are going to do is to approach the situation with understanding what pain is behind that. So there will be sense of self-compassion that can lead to more supportive and healing environment internally. Now, shame and guilt often accompany addiction, and they create barriers to recovery. Now, compassion helps in dissolving those feelings, opening the way for healing and acceptance. And for example, think of somebody who's guilty for their substance use. By applying compassion, they can begin to understand why behind their behaviors, which often stems from need to manage pain. And so self-forgiveness is absolutely a crucial step in recovery, which is made through compassion. When individuals learn to forgive themselves, they unlock a power within them of healing. For instance, someone might forgive themselves for the harm caused during the period of addiction, recognizes that their actions were influenced by unaddressed parts in distress or pain. And what we do is we engage in compassion with various parts during the process. And this could give a, a view of something like a mental conversation with the part that seeks substance and understanding its protective role. So why do they do that? To release pain or to overcome pain. And then starting to reassure it that the self is capable of finding a healthier ways, coping mechanism, by healing the underlying pain or traumas from the past. So compassion is critical to IFS therapy. It allows individuals to approach their internal parts by understanding and care, reducing internal conflict, and fostering a healthier environment. Now, practical application and what are we going to do? I mean, this is to do with also our session today. Okay. In our session, we will begin by addressing first question that I sent to most of you, of what behavior or habit related to your addiction would you like to better understand or change? So what is that behavior or habit is that you struggle with, okay, that you would like to work on? Because this will help us to identify that habit that you struggle with. And for example, if you often find yourself drinking excessively when stressed, then this will explore the underlying part that drives the behavior, okay, the pain behind it, and seeking to better understand. And so once we have identified the behavior, which is what you are going to look at, then we'll focus on the pain that creates that addictive behavior or as a coping mechanism. And we'll explore that message that this part is trying to send to you. And what we will also do, and you'll see me doing, is that I will ask to the shaming part or the judgment part to step away while we work with the part that is having the behavior or the addictive part. This is important because today it's kind of mixed up, and that's why it gets isolated. And only when pain is high, it comes up and makes you do what you're doing as an addictive behavior. And then what we'll do is we'll reflect on self-compassion and its impact. So next, reflecting on your second, there's a second part of the question, which is what behavior makes it brings more kindness, more compassion to self. And of course, the most important is to address the part that carries shame and guilt. And once we have done the part which is addictive part, we will then move to the one that carries shame and guilt about the addictive behavior. And this exploration will help you see how compassion towards this part can elevate his burden and foster a healthier relationship. And finally, when these parts feel the compassion, the dialogue with these parts, this dialogue aims to create a little bit more understanding, empathy within yourself, and that will help because you're helping these parts to express their needs, their fears without judgment, and under guidance of your core self. So today's session is structured that will take this practical use of your what you have prepared, and then by engaging and understanding these different parts, we can aim to foster a healing process that not only addresses the symptom but tries to go towards root cause of the addiction. Okay, so what I want you to do is to just take a moment to see, and you can list many, and the idea is for you to make this list and then take one that you can work on today, and you can come back on the others with the recording. So take a moment to think about what behavior or habit would you like to better understand or change. And see if you can choose one. And here we go. Now just be comfortable and see if you can keep a pen and paper next to you if you want to jot down your insight during the or after the exercise as you feel appropriate, and just go into a relaxing position. Now begin by centering yourself with your breath. So inhale slowly and deeply through your nose, letting your lungs fill completely, and then gently exhale through your mouth, releasing any stress or tension. Breathe in and breathe out. Now let's establish your safe place. Visualize a person, a place, a memory that brings you sense of serenity, protection, and wellness. It can be a place, a person, a memory. That brings you a sense of serenity, protection, and wellness. Now, this safe place is your sanctuary, providing comfort and stability. And whenever you need it during the session, you can encourage your system to take you to this safe place, as it nurtures feeling of security and connection. Now, with your safe place clearly envisioned, just gently shift your focus on the specific behavior or habit you're struggling with. See yourself enacting that behavior or habit. And as you do that, just notice any physical sensation that you feel in your body or images linked to that coming into your awareness. So either you feel it in your body or you may see images. Notice any discomfort, tightness, or any other response that you have. See if you can tune into the feelings associated with the behavior or the habit. That you either feel it in your body or you see as a visual. Can be in your body, can be around your body as well. Notice your feeling towards this sensation or image. See if you can become curious to understand more. And if somehow you hear voices that appear to be judgmental or shaming or guilty, could you please ask these voices or part to step back into a waiting room? Promise that you will be back with them within the session. If they can just step back, make space for you to connect with this part associated with the addiction. See if it allows you, gives you space. Now go back to the sensation that you felt when you connected in your body or an image. And keep an attitude of curiosity and even compassion within this exploration. Ask a question to this sensation in your body or this image from curiosity. The question is, what is your intention for me? What do you want for me? And just notice what you hear. Remember to stay curious. and see if it makes sense. And if it does, just acknowledge by saying, I understand what I hear. Now ask this part of you or the image, is what are you afraid would happen to me? What are your fears? Or what pain are you protecting me from? If it makes sense what you hear, can you just acknowledge? And ask a question. What are you really afraid would happen to me? What is your biggest fear? And see what you hear. Ask another question. When did it all start? How old was I when you took this habit? It will tell you an age. And just ask it, what was going on then that made you do this for me? And see if that makes sense to you. And if you can acknowledge, and if you can be compassionate towards it. And ask it if it's willing to name itself, if this part would want like to name. And just ask it a name, saying, how can I call you, address you? And just take note of the name. And ask if it is willing to heal the younger self. The younger, the age that when it started to do this. So see if it's willing to heal the younger self where the pain started. If it says no, ask it, what is it afraid of? ask again if it will be willing to heal the younger self. And if it says yes, then let it know that you will come back for healing the younger self on a later date. Now that you have the name, you know how old it was, and you will do it. Assure it that you are going to do it. I'll ask you the last question. What needs to happen for this part to be relaxed or to be less present? So what needs to happen for this part of you to be relaxed or to be less present? I'll give you some guidelines or actions. Stay curious, stay compassionate. Now see if you can offer gratitude to all aspects of yourself, especially to this part that came in, and shared with you, and assure it that you are going to come back and continue this dialogue and the journey forward. Now take a moment to pause, let this part be free, and by saying, I'm going to come back to you, because I'm going to now invite the part that is opposed to this habit. It could have come in with that judgment, shame, guilt, and that we put into the waiting room. So see if you can take a moment to bring into your awareness any part that is opposed to this habit or behavior, that has a feeling of shame or guilt or judgment, and see if anything would like to show up. Breathe. So you're asking if there's any part of me that feels guilty or shamed about this behavior, if you would like to show up now. And notice if you have any physical sensation in your body or images come up, or any form of discomfort or tightness. Just stay curious. And see if you would like this part, which if it's in a part of your body or it is an image, if it would like to be in front of you, so you can have a conversation with it. And just be curious and maybe a bit of compassion if you can. From a place of curiosity, ask to this part, which could be in your body or in front of you or an image, if it can tell you what is its intention for you, what does it want for you, and see what you hear. And if it makes sense, can you just acknowledge? Yeah, I get it. Stay curious and ask, what are you afraid would happen due to this behavior? I mean, what is its fear? What is its biggest fear for you? Ask, if that's what you're afraid would can happen to me, then what is your ultimate fear for me? If it makes sense, can you just acknowledge? Saying, I understand, because this is what it is protecting you from. Feel compassion, just acknowledge. And then ask a question. Since when do you feel this way? How old was I when you started doing this? Tell you an age. You can ask what was going on then. See what it shows you. Stay compassionate. Now ask it if it would like to name itself. Give its name, so that you can call it with that name. Doesn't matter whatever name comes in. And now ask it, what needs to happen for it to relax and be less present? Now take a moment to offer your gratitude for this part to participate today, for sharing, and see if you can also bring back the other part that was there. Invite it in by the name. And notice how you feel towards it now. And tell both of them, both of this part that came up, let them know that you are going to be in contact with them every day. And if the two of them have shown the younger ones Say, I will work with your permission in healing and reducing pain to the younger one. And notice how they react, both of them. Thank them all. Thank all your system to be here. Each and every part that has come in to work or that have stayed on the side. Thank them all. And when it feels okay, just start to come back. If you want a few minutes to take some notes, go ahead. We have some time. We'll do a short sound meditation, sound healing. Just take a moment. Okay, so if you are new, coming first time, just a short reminder. So we use tuning forks to correct any disturbance which is there in your torus field. Okay, so as per bifield tuning, any distortion in the field creates issues, okay, emotional and otherwise. And so with the tuning forks bringing in, basically we try and release them. And so just what you have to do is to be in the moment with it and notice what it does for you in your body and in your emotional state. So what we do is we open the two centers. So below is the feet, top of the head. So open the channel, okay? And then use a pendulum to understand, based on what you are dealing with, which chakra or what center, energy center we have to work with. And then basically you start at the time of your conception in the womb and then all the way back to the present moment. And every time something is distorted, I will kind of tell you an age and even sometime an emotion, that this is what could have happened, or a voice, and see if it means something to you. What you're going to do is you are going to bring it into your awareness, the memory or whatever that comes up for you, and that's okay, no judgment. And then I'm now going to ask you to breathe and use the tuning fork as a way to release. Okay, so the breathing is going to be, take your breath in from your mouth or from your nose, deep in, and then you breathe out from your mouth, exhale. That's how we are going to do. And in case there is a very strong emotion sometime, I would also ask you to do something like and you release. Okay, you're not going to see me video, but you're going to hear. Okay, here we go. So just relax, be in a comfortable position, and here we go. So I'm going to start below the feet with the tuning fork, which is 174 Hertz, opening the channel. So I'm below the feet, about 1 foot below your feet, pointing towards your head, so to your backbone. Take a breath. And there's a heaviness in the middle part, in this, what is called the solar plexus, and in the back. So just ease. Take a breath. There we go. Take a breath. and grounded you. So we're going to go to the top of the head and open from the head the same. Open the channel. I'm pointing onto your head and opening the channel to your backbone. Take a breath. The throat. So just take a breath. Take a breath. Okay. I'm going to run a pendulum so you will not hear anything. See anything is because I'm running a pendulum through all the centers, starting from foot to knees to root. If I find something, I'll tell you. To sacral, solar plexus, heart chakra. Not surprise. It's coming to throat and left. Opening up everything. So it's throat chakra, left side, which is all the unexpressed emotions, creativity and truth that has been blocked in the system. Okay, so I'm going to change the tuning fork. It's going to be now 144 Hertz, and I start from your time of conception, so in mother's womb, and then go up to the birth, and then from birth to present moment. So that's how we'll do. I'll tell you if you're new, just for you to know what I'm doing. Okay, here we go. So this is the time of your conception. Okay, this is where we'll start. So I'm about 6 feet left of your throat. Okay, now we are there. The voice that is coming up is somebody's regretting, but it's got nothing to do with you, it's to do with their own past. And that's what is picked up by your system. It's a regret, but it's not to do with you, with their own story. So it can be one of the parent or both. So just take a breath. Yeah, it feels heavy, so see if you can take a breath and release it out by a big noise like I did. So I'm changing again, tuning fork, just to release this out. Seems heavy. Actually, it is affecting the third eye. Okay, so I'm going ahead. still in pregnancy, mother's womb. Okay, so it took me to the time of birth. Yeah, there is always anxiety, mostly in the stomach, coming into the world. So see if you can send love to your mother, the nursing staff, people around you. There's a lot of fear there, but just send love. And see if you can send love to the little one as well, coming in. So the fear is intensified. Yeah, it's afraid. It's afraid of being powerless. Little one. Take a breath. Just let it know, let the little one know that you're going to be fine. Take a breath and free. Okay, so now it's about 2 years old, between 2 and 3. And straight into the throat, left side. So see what it wants to say but can't say. Not allowed to express emotion or creativity or truth. Let it go. Okay, it wants to hold on. So you take a breath. Okay, it eased. It wants straight away to go to your mother's. So it's what your mother carried from her lifetime, her experiences, that is affecting you. And it's it's straight into the chest, a lot of sadness. What she carried that you feel as well, that you have not been able to express. So see if you can just send love to her, hold her. And send love to yourself. There's a lot of weight on the chest. He's asking me to tell you that you have to take away any filters that you hold on speaking your truth. And feel safe about doing it. Yeah. Okay, now I'm going to release all of this. Okay, we're just going to do the close all what we did. So allow it to continue to work for the next 48 hours. And then conclude with the 528 hertz as a cocoon. Continue to breathe, inviting calmness and understanding into your being. Now take a moment to acknowledge your internal system. Recognize the parts that have surfaced today, and each with its role, history, and how they contributed to your unique journey. Take a moment to honor all parts you're connected with. Appreciate their efforts to protect you and the roles they played in your story of recovery. With kindness, express your gratitude to these parts and thank them for their courage in communicating and their dedication to your healing process. As we prepare to conclude, reaffirm your parts, your dedication to a balanced and compassionate internal environment. Trust in the guiding presence of your core self to continue to nurture and guide you and dialogue with you. Now, with one final depth, deep breath, let go any lingering uncertainties and gently open your eyes. Thank you for your presence. May the compassion and understanding you nurtured guide you towards a healing, balanced inner peace.